little piggyback off the last couple I did about deadlifts being fine, back squats being fine, that there's way too many people on the internet that have clout that keep saying that these things are dangerous for some reason. But so I wanted to go back to the deadlift for a minute, because not only do I work in a personal injury clinic, and it's kind of what I do mainly, but I do a lot of coaching, barbell lifts, weightlifting, powerlifting, CrossFit, and I also do some online work with a group. And we have a gentleman in one of our online cohorts who had fusion surgery in his back, but not just typical fusion surgery. He had 15 levels fused. 15. Okay. So he had a 15 level fusion. And guess what? He deadlifts in our training cohort. He was doing 225 for reps. Sets of 2 or 3 the other day. Great form, zero issues, zero contraindications to using the deadlift after a 15 level fusion. And that's where most people get tripped up. Most people that have back surgery don't train. You kind of see a lot of that anyway. They don't have any sort of training history, don't have any desire to train, and many of them have so many comorbidities that they still hurt and still have loss of function even after they have these multi-level fusion procedures. But this gentleman had some issues with back pain, nerve issues. I don't know. There's a lot of stuff happened. I don't have the full history on it, but whatever ended up meaning he had to have 15 level fusion. But he was able, with time, to get back to doing what he enjoys, and that's training to make sure that his life maintains good quality, good quantity, maintains good function. So most people out there would be too fearful to do anything of use after that kind of procedure. But it's up to you. There's no contraindication, and you can look through this all you want. There's no contraindication to training after a spinal fusion. Once the procedure has been done, healed, and whatever hardware they've put in has taken strong hold into the body, there's not restrictions on this stuff. So I've had this guy in particular came to mind because of how many levels he had fused, but I've worked with several people who have had spinal fusions after big disc injuries or other things, big back traumas. And I've had people work their deadlifts back to 400 or 500 pounds with no issues. So in the end, it's up to you. How much do you want to continue to do after having a big procedure is on the person. The surgeon's going to clear you to get back to as much as you can tolerate. And if you just want to sit around and complain and don't do anything for the rest of your life, that's up to you. But I'm more interested in helping and working with folks that are interested in getting back to as much as they can after a big procedure like that. So just remember, if you've had fusions, you can get back to training. No one's going to stop you. You can have 15 levels fused and still get back to deadlifting from the barbell. So talk to you later. Check my page for more. See you next time.